And I'm joined in the studio now by Dr. David Kwak, clinical instructor specializing in family medicine at Soonchunhyang University Hospital. Good morning, Dr. Kwak.
Good morning.
Thanks so much for joining us once again. So we are constantly hearing news and more developments. It seems a lot of it may be repetitive to you, but I think because we're hearing conflicting reports here and there. And so we want to get maybe an expert's view on that and hopefully maybe debunk a couple of myths along the way as well. So Dr. Kwak, let's start off with something that got a lot of people excited. And that, of course, is the vaccine that was, or trial that was made by Moderna, because they tested 45 people. Many of them developed antibodies, 8 of them neutralizing antibodies. So it seemed to be the best sort of option that we have right now. Newspapers, media were all over it. Stock prices went up about 30%, I heard.
Right, and then we went back down.
Exactly. So what is the deal with Moderna?
Okay, so Moderna is a company that plans to make a completely new type of vaccination. As we've talked before, we've always had some sort of a plasmid type of vaccine, meaning a certain virus type of vaccine or antibody type of vaccines. But Moderna claims that they're able to make an mRNA type of vaccine, which we did not have before. So they're sort of a pioneer in that regards that everybody is getting high hopes for. And they recently made a public announcement of the results of the study that they recently did in their clinical trials that they tried vaccinating 45 different people divided into 3 different groups according to the dosages of the vaccinations that they were put in. And out of those, 100% of them did come up with some sort of antibodies.
Right.
So that, I guess, was a very good news. Now, first, 8 people of those 45 were tested for possibilities of neutralizing antibodies. And this, I have to sort of explain what this basically is. So this test is called a PRNT, and it tests if the vaccination actually had the ability to create neutralizing antibodies as opposed to any general antibodies.
So if the virus came into your body, this vaccine would be able to fight it or neutralize it so that you wouldn't become sick because of it.
Theoretically, yes, because it's still being done in a lab setting and not so much in a clinical setting of finding out the neutralizing antibodies. So 8 people did go through it, and all 8 of them did come up with the neutralizing antibodies. Except what we have to know is that it was the first 8 people that went through the test. So they did not provide information for other 37 people. We are yet to know the outcomes of those 37 people yet.
So there was a lot of, after a lot of excitement immediately, there were a lot of people kind of speculating about maybe, they maybe were a little too impatient about coming out with this good news. They're not supporting it with more data and not allowing other people and other experts to examine it in more detail as well.
Right.
So what's your kind of take on this? So is it something that we should be optimistic and excited about? I mean, Dr. Fauci from the US CDC also said that he was kind of excited, but then we're not hearing much about it since.
Right. Well, personally, I'm not going to be too hyped up about it. I will try to remain as neutral as possible because, as we said before, all these vaccination clinical trials, they usually take at least a couple of years to even 10 years at maximum. And they're trying to sort of hasten the process into even a year of a period of time. And that's really, in the view of medical realm, it's too hasty because that doesn't give us the necessary time to seek out all the possible side effects, long-term side effects, so to speak. And that being said, what happened last week was actually a public announcement from the company. So obviously they made only the points that they wanted to. And I don't know if that was intentional. I can't really tell if they did it intentionally, but they skipped on some of the information that people might could possibly want more from.
Right.
Right.
And like we said in the beginning, that sent their stock prices soaring. And after that initial sort of good news, they did offer a stock offering. And that was, I think, added to the uproar
I would think
about,
so, yeah.
yes.
Right.
The mRNA that you mentioned, though, you said that this is something that's very exciting and new. I heard some other experts saying that the reason why this is so new and the reason why it hasn't been used in vaccines before is because it's a bit too new or it's a bit too unsteady or unstable. Can you tell us a little bit more about that?
You are actually very correct in saying that this mRNA is basically, we already have mRNAs inside our body. What it is the function of it is called messenger RNA. And RNA basically is a copy of a DNA that transfers certain information in regards to replication of cells. And obviously, when we think about viruses, all they want to do is replicate and to invade the whole body. This mRNA vaccine method, because it's so new and unknown, there is so much high hopes for its efficacy that it'll be very effective in spreading through the body to come up with possible neutralizing antibodies and whatnot. But it's so brand new that we don't know what it's actually going to cause, possible side effects, how it may affect the cellular processes and et cetera. So I think it's at this point of time, we should be more careful in regards to speculating what will come from the mRNA type of the vaccination.
Right. Well, the company apparently, because it raised some money through its stock offering and stock prices have gone up, they are going to go ahead with more trials on a larger trial basis as well. So hopefully we'll keep our fingers crossed that they do actually succeed. I just want to mention a tweet by a tech-focused broker, Gopal Kavaliredi, talking about how Moderna stocks were up 25%. And then he said, I hope the vaccine also supports immortality.
Right.
I think more of a tongue-in-cheek comment there.
Right.
All right. Let's then talk about, of course, vaccine race is on around the world. We know the other one is there's one by China, and then there's one by the University of Oxford that has partnered up with AstraZeneca, the global pharmaceutical company. They also started human trials. They hope to have 1 million doses ready by September, and then to dramatically scale up manufacturing after that. So it seems that no matter who gets there first, then there will be the ethical axis of who gets the vaccine first. Because as we know, more than 5 million cases around the world. You mentioned before that the normal time frame for a vaccine is probably a couple of years. Within a year or even 2 years is very, very, very hasty.
And that would be even minimum.
Yeah, that's rushed. So, but we're still hearing reports through the media, whether it's government authorities or medical scientists, they're saying, no, maybe something can be up before the end of the year. So there was talk about a September timeframe.
Right. As you said,
what do you think about that?
Right. As you said, they are we're in this race to come up with a treatment for this COVID-19 because as we can all experience and see that it is so dire. The effect of the virus and the whole global economy, not just the economy, but the mortality rate, the illness, it's so dire that somebody has to come up with one answer that cures it all. So everybody's just going to go against the time clock to come up with something, and they're obviously going to expedite the process to come up with anything possible. I would say September timeframe is possible at this point in regards to finding out some sort of treatment for it, but except then we have to go back to the same issue again with the Moderna, that clinical trials are in such length for a very specific reason. We had to still seek out for possible long-term side effects and what other even positive effects it might even can cause. So given the situation, I still have a very high hopes for any kinds of vaccination trials that they're going through, except once we pass that certain, let's say something comes up in September and people get treated by it, but we still have to give it at least a couple of years, 3 years, a few years afterwards to see what comes in the long term afterwards.
Right. And I guess that September timeframe is maybe because of all those experts warning of a second wave, a major wave coming in the fall or the winter. We haven't even officially entered summer yet, and we're already kind of worried about the fall, but Given what's happened in Korea with the Itaewon infections and the continuing nth transmissions, do you think we're ready to handle a second wave? Your personal opinion right now?
Well, I really don't like to be the negative person as always am here. But no, we're not. We're absolutely not ready at all for the second wave because, as I said before, we have no treatment methods available at this point. We have no way of getting rid of the virus if it comes again. So we're not ready with for the second wave. But also, as you mentioned, when the flu season comes, that's more worrisome because this particular virus, COVID-19, is known to be able to co-inhabit a person, meaning a couple of different viruses can invade a person at the same time, which is not usually cases for the other viruses.
So you think you have the flu, and you do have the flu, but then you can also have COVID-19 at the same time?
Yes, that's what
that makes it even more difficult to detect.
Right. But so from the beginning, so what we did was screen everyone out for both the influenza and COVID-19.
Okay.
I think that's what's going to happen in the fall, possibly at the time.
And we should still take our flu shots then?
Absolutely. I think we need to be increasing the amount of influenza shots for the people.
In fact, I think government authorities are considering maybe extending the availability of free flu shots as well ahead of the flu season. All right. There was also talk about mutation and strains. We've talked about it before on the show, but I think because of the Itaewon infections, maybe it's because of blame game, or maybe they're just trying to understand why it spread so quickly and to so many different people through 6th or 7th transmissions.
Right.
Is it because it's a stronger strain that apparently comes from Europe and the Americas?
Originally, I said no. But now I'm beginning to think that it might be a possibility. So these strains that we're talking about, it actually comes from mutations. And every single passings of a virus from a person to another person, a little bit of mutations always occur. And if that mutation gives a stronger, let's say, life for the virus, it stays and that becomes a strain. And because it's stronger, usually in terms of infectivity, it's strong. The strains tend to get stronger in infectivity. I think that's what possibly we are seeing with the new strain that has come up in the Itaewon area and why it's so spreading much even quicker than before.
But what's also concerning is because we saw the huge numbers of fatalities and people really getting sick in Europe.
Right.
Obviously, there are differences with the healthcare system, but should we also be concerned that the mortality or the fatality rate of this strain could be even stronger?
I'm going to say if the strain is actually the same as the one from the United States and Europe, I would say that we need to be more careful with the new virus strain that is coming in.
All right. So I guess with the lack of a clear treatment and a vaccine, we have to stick to the basics, as we've stressed over and over again. I did want to ask you about this. We've talked about this QR code now. It's supposed to help track people who go to bars and establishments like that. But there are restaurants and there's eating.
Right.
And I read one thing. This cardiologist at UW, Dr. James Stein, said that COVID-19 is spread through respiratory droplets, not food or incidental contact, actually. That food thing really got me thinking because in Korea, of course, we have this culture of sharing food.
That's
and
correct.
We go to restaurants. Many people go to restaurants, maybe not bars or clubs, but I know a lot of people go to restaurants.
Right.
So what is your opinion on that?
I would say, so from the COVID-19 patients, we are starting to notice that a lot of them have gastrointestinal symptoms. And that sort of gives me an idea that it might actually be transmissible through saliva and obviously through food sharing. And also, if we track back to the first patient that we had in Korea, a friend of a person who came in from Wuhan was actually having a dinner with him, and that's how he got exactly.
Right.
So we have no way of knowing that whether he might have gotten it through the respiratory droplets or through saliva on the food. And there is also proof that a lot of the viruses is being found on saliva if tested, also inside the defecation communications of people. So I think it is quite possible for people to actually be transmitted through food sharing.
So even if we do go to a restaurant and we're eating at home also, maybe this is a good time to refrain from sharing the same pot, use different side dishes, make sure that you don't mix your utensils and whatnot.
Personally, I would think so.
Thank you very much, Dr. Kwak, once again for coming in and answering our burning questions regarding COVID-19.
Well, thank you for having me.